Welcome to Joburg Fertility Center. Join us as we share expert insight, medical advancement, and patient-centered solution to help you achieve the best possible outcome. Today, let's talk about the key takeaways from IVF Egg Retrieval Day. Some people will call it egg pick up. What to expect, what to know, and how to prepare. What is egg retrieval or egg pick up? A minor surgical procedure to collect mature eggs from your ovary, performed under mild sedation or anesthesia, usually done 36 hours after the trigger injection. On arrival at the hospital and preparation, arrive early with your partner if the sample of the sperm will be required. Fasting is required from the patient, which is no food or drink for 6 to 8 hours prior or before the procedure. You'll be monitored and be prepared by a medical team. The procedure explained. Duration of the procedure may be 20 minutes to even 30 minutes. Transvaginal ultrasound guided needle is used. Eggs are gently aspirated from your follicles. You are rest in recovery for about 1 to 2 hours afterwards. What happened to the eggs? Collected eggs are evaluated in the lab. Only mature eggs are used for fertilization. Partner sperm or a donor sperm is prepared for fertilization. Possible side effect of egg retrieval: mild cramping, spotting, or even bloating. Fatigue or dizziness from sedation. Most patients feel better within 24 to 48 hours. Watch for the following complication after egg retrieval. A rare condition but can happen is ovarian hyperstimulation syndrome, OHSS. Contact your clinic immediately if experiencing the following: severe pain or bloating, nausea, vomiting, or weight gain, fever or heavy bleeding. Post-procedure care. Rest for the day at home. Take light meals, rehydrate yourself, and avoid heavy activities. Use prescribed pain relief if needed. No intercourse for a few days. When will I hear back? Expect the lab or the doctor to inform you within 24 to 48 hours. You will be informed about the number of matured eggs retrieved. Secondly, you will be informed about the fertilization success. Thirdly, the embryo development plan will be explained to you. What next? Embryo transfer can be scheduled 3 to 5 days after egg retrieval in a fresh cycle, or freezing of embryo for later transfer, which is called FET, will be done usually on day 5. possible genetic testing, PGTA, before transfer may be recommended by your doctor. Thank you for your watching and being part of this journey to understanding fertility and reproductive health.